Did you know that snoring can wreck your oral health? It might seem like a harmless, albeit annoying condition, but its implications stretch far beyond the realm of sleep quality and into that of oral health. Today, we delve into the 4 reasons why snoring is not just a nuisance, but a potential threat to your pearly whites. First up is dry mouth. Snoring often goes hand in hand with mouth breathing, which can lead to dry mouth. Saliva, nature's mouthwash, helps to cleanse the mouth and fend off decay. When the flow of saliva diminishes, as in the case of dry mouth, the risk of oral infections and tooth decay sees an uptick. Secondly, we have gum disease. The reduced saliva production associated with snoring can also increase the odds of developing gum disease and gingivitis. These conditions, if left unchecked, have the potential to escalate into more serious problems, including tooth loss. The third reason is tooth decay. The combination of dry mouth and gum disease creates a fertile ground for tooth decay. The increased bacterial activity due to reduced saliva can lead to the erosion of the tooth enamel, resulting in cavities and decay. Last but certainly not least, snoring can lead to bad breath. This is a direct consequence of the dry mouth, an increased bacterial activity that comes with snoring. When the mouth dries out, it becomes a breeding ground for bacteria, which can cause a foul smell. So there you have it, the 4 reasons why snoring is more than just an impediment to a good night's sleep. It's a dry mouth instigator, a gum disease risk factor, a tooth decay promoter, and a bad breath cause. But fear not, regular dental checkups and good oral hygiene practices can go a long way in preventing and treating these oral health issues associated with snoring. So remember, while the snoring might not be within your control, your oral health certainly is. Prioritize it and give your teeth the care they deserve. Thanks for watching.